This is the Hip and Groin Injury Prevention Program. The purpose of this program is for activation, lengthening, strengthening, and dynamic stabilization of the core, specifically the adductor musculature. The exercise selection concept is one trigger point and foam roll exercise, one static range of motion, one open kinetic chain, one closed kinetic chain, one dynamic movement, and one end range strengthening exercise. This is a 2-day program that are done on alternating days. All exercises are meant to be done pre-participation. Day 1 exercises.
Foam roll adductor, starting at the groin, working all the way down towards the knee, and back up towards the groin, back and forth. Trigger point for the psoas, place the ball in the high hip, stomach area, search for the most tender point, and hang out and breathe. Lateral leg swings, driving the leg up as high as you can to the side. Sumo squat stretch, using the physio ball, getting deep into a squat, driving the knees out with the elbows. And advanced sumo, using just the wall, again pushing the knees out with the elbows. Goblet squat, sumo. 4-way hip, straight leg raise, lateral leg raise, straight up and down, hip extension, keeping the leg straight, activating the glute, and adduction, keeping the leg straight, raising it up towards the center. External rotation with the band around the ankle, lying down, externally rotate the leg at the hip, and also doing this face down, again externally rotating at the hip. Internal rotation, lying on your back, internally rotate at the hip, pushing that foot to the outside, and face down as well, internally rotating at the hip. Lateral lunge with the slider. Move the slider out, sinking into the lunge. Pull back in with the adductors. Single leg balance on an air pad. Bouncing the med ball, the chest pass towards the wall.
Day 2 pre-participation exercises.
Trigger point for the groin. Softball or a med ball deep into the hip, using the high box to get in there. Piriformis foam roll. Place a foam roll on the hip, cross the leg over, and roll back and forth on the hip and glute. Single leg hip with rotation, using the box to balance. Keep your stability on the down leg. Externally and internally rotate at the hips. And more advanced without the box, again maintaining your stability in the down leg, carefully externally and internally rotating. Super frog or unilateral hip stretch, place a weight plate on the hip and relax and open up the groin. Glute bridge with hip rotation, knee bent, externally rotate, stabilize with the down leg, maintaining glute activation. Wide stance, theraband with rotation. Maintain your balance. Tight core, rotate through the hips. Resisted shuffle with the partner, keeping the legs apart, pushing with the side. Split stance throws in a deep lunge position. You can use a body blade or a water bottle, going up and down